When you're conducting clinical research studies in resource-limited settings and multinational settings, what we might loosely think of as global health research and international multi-center clinical trials, then you may face a new set of challenges in all aspects of clinical research data management. We've already discussed some of those in the context of multi-center studies. Now, we're going to take a quick look at some additional challenges. But if you are currently working in such settings, I encourage you to start a discussion on the forums to share your experiences and explore the topic further with other students. In this course so far, we have considered designing your clinical research study, identifying best approaches to capturing your study data, paper versus electronic systems, for example, and designing your data collection forms. Now we're going to rethink those steps in the context of resource-limited settings, which often means low-income countries, middle-income countries also, though many of these concepts also apply to work in rural parts of the United States, for example. It's important to understand your setting, rethink your data collection plans, and redesign your data forms as necessary. Our focus will be on multi-center clinical research studies where you need to be in touch with a coordinating center. But these general lessons can apply to single-site studies too. To start, there's an ongoing debate about whether it's ethical to conduct clinical studies in developing countries in the first place. Can researchers in these settings effectively explain the motivations of research, and can patients truly give informed consent? Or are research institutions and drug companies exploiting populations in order to save 60% of the expense of a study? Even in collaborative studies, it's important to ensure one site isn't providing all the data while the other gets all the scientific credit. It's an important debate, but not the focus of this course. I'd recommend you take a look at this great January 2013 summary by Debating Matters, which has arguments for and against, with plenty of relevant links to media reports and the scientific literature. To get back to data management, your solutions for a clinical research study may need to be designed to accommodate limited infrastructure and resources. Here are a few of the key limitations that may affect data management capacity specifically. Many of the approaches we've discussed in this course rely on computers, computer networks, and mobile devices to handle clinical research data. That is, to collect it initially, curate it, and monitor its quality, and to analyze it. While those computers run on electricity, the availability of stable sources of electricity is important to most clinical research functions, to run your equipment and charge batteries. Frequent blackouts, brownouts, or a lack of electrical service entirely will change your data management plans. Voltage fluctuations, too, can damage sensitive electronic equipment. The availability of internet access should also be a concern when developing your study plans. If you are conducting a multi-center, multinational trial with performance sites that have no internet access, sporadic internet access, or slow internet access, then web-based data entry, like we've been using with REDCap in this course, isn't realistic. It's likely that activities like hands-on teaching, monitoring, and data auditing will need to be done in person. Conference calls may rely on mobile phone connectivity instead of having a group meeting with web conferencing software. And even if the study site has fantastic internet service, there may be an unacceptable network lag if your data entry system is hosted in the US and your study is in Australia. Test all of these considerations before you deploy your data capture solution. For the data equipment that you do have, will you have the necessary environments? Will you have a secure, locked room, even monitored if necessary, where your documents or equipment with PHI can be stored? High-powered servers may need climate-controlled environments to function, but so do paper documents for long-term storage. Even regular devices, tablets, laptops, fail to work in very hot, cold, or humid conditions. Have you ever seen one of those "device is too hot to operate" messages on a smartphone? It's likely you also rely on a shipping service for deliveries of study equipment, study drugs, lab equipment, data capture forms, etc. Can you receive these in a timely fashion? Will you have reliable phone service to join meetings, report serious adverse events, or request support from your coordinating center? All of these services may be available and reliable to a degree that fits your study, or they may not. These are great conditions to include in your handbook of operating procedures. For each different research setting, you will likely have different regulations with which you need to comply. National guidelines may determine whether you can store blood samples or ask about race in a survey. We've generally covered U.S. regulations for data privacy and security in this course, but you may need to comply with stricter requirements in other countries. Many research groups in developing countries face challenges hiring and retaining data management personnel. General computer literacy may be low, and the training and certification programs often aren't available, so anyone with these skills is in high demand. Research teams can benefit from structured training plans to develop the necessary skills in newly hired staff, along with lots of supervised, hands-on practice. If you have study sites in diverse settings, it's likely you'll need case report forms in multiple languages. These will need to be translated and back-translated, tested in context, and reviewed by the appropriate IRBs. Test the meaning and interpretation of your form and survey questions with local personnel too, even if you're familiar with the language. And if you're a coordinating center dealing with study sites across multiple time zones, be prepared for additional complexity in tracking events and providing support and training to your sites. The attitude of people in your study setting towards research plays a huge role in both your study and your data plan. I've encountered researchers in extremely resource-limited settings whose support team shares a passion for health research. I've also spoken with researchers who did not have the support of their hospitals or institutions. One researcher had to bribe her hospital's record room staff in order to access records for research. Be a positive face of clinical research to establish the necessary networks of trust. There are also equipment challenges to consider if you're planning a computer-driven data collection in resource-limited settings. How are you going to get the equipment and necessary software? It can be expensive to order and ship to you. There are often import restrictions or, hand carrying them as a traveler, restrictions on how many laptops you can carry back into a country. We've already talked about electricity, but you may also need everything from battery backups and surge protectors to server racks and generators. You should also document in your SOPs how you will handle maintenance and repair of the equipment. The estimated turnaround time will help you plan how many replacement items you should have on hand for immediate use. Not all software may be available in the country you're working in, or it might not be available in the local language. I worked with one clinic in a middle-income country that indicated they didn't want to use tablet computers for data collection at the point of care because it gave the appearance of wealth, and they felt that delivered the wrong message to the underprivileged population they served. In other places, carrying expensive equipment can make you a target. You would be risking not just your technology and data, but your personal safety. It's not worth it. On the other hand, mobile flip phones seem ubiquitous in some resource-limited settings, so they might present a good data collection tool. Designing data collection interfaces for mobile devices would be a good course topic in itself, and while we haven't included it in the first course iteration because of time considerations, we acknowledge its importance. Paper can be an excellent solution when working in resource-limited settings for all the reasons described on the previous slide. Just don't forget, paper forms are more error-prone and require more work to prepare data for analysis or to send data to a coordinating center. Many of the resources you might use for retrospective review are on paper: medication dispensing books, lab results records, patient records. But electronic health records, laboratory systems, and electronic pharmacy systems are becoming more prevalent. Open source solutions like OpenMRS are very popular, and I've seen many locally developed custom systems also. Finally, let's take a look at some examples of how understanding the local setting may change the design of your form questions. There aren't great available guidelines on this, so I'll share with you some examples of challenges I've learned from researchers working around the world. In one data collection effort in the Caribbean, local researchers explained that a participant's full name and birth date were ineffective as reliable identifiers. Sometimes the study participants never knew their exact date of birth. and high illiteracy meant that many could not spell their names. Different phonetic spellings by different study personnel led to confusion on forms. So they began to collect mother's name as an extra identifier in these populations to help distinguish individuals. It was a new and unexpected field to include on forms. Similarly, frequently changing address information for transitory populations, changing or non-traditional means of contact, etc., may require forms that query these items more frequently. I heard another example from a local researcher in a Southeast Asian country who was responsible for distributing surveys to a number of healthcare clinics. One question on the survey read, "Please indicate which support services are available for persons followed by this facility. Circle the numbers for all applicable responses." And this was followed by a long list of options. According to this investigator, personnel at the sites interpreted this differently. Culturally, they considered it impolite to say no, and therefore felt uncomfortable responding that a service was not available. So they often marked, yes, it is available for the majority of services listed by circling most of the numbers. They would accept that available might mean after a 6-hour drive to the nearest city. But that wasn't the response the survey designers intended to elicit. In comparison, a different survey question allowed respondents to say whether services were available on-site, off-site at a distance, or not at all. And adding these shades of gray produced more representative answers. We've covered in a previous lecture the utility of numeric coding, sometimes good, sometimes excessive work, but 0 for no and 1 for yes is a very common mapping. One data manager in a French-speaking country explained to me why his team didn't use that system, though. They found that the 0 for no was visually similar to the O often used as an abbreviation for oui, meaning yes in French. This created a sort of cognitive dissonance with data entry personnel and resulted in higher error rates despite training. When they switched the coding to 2 for no, the error rate declined. Finally, pediatricians I met from Central America had no pediatric scales in their clinic, like the scale pictured here. They only had an adult scale. So in order to measure infant weight for their internal study, they recorded the weight of the mother holding her infant, and then the mother alone, and subtracted the two. Their paper forms contained spaces for all these measurements and the resulted calculated infant weight. And once they received a pediatric scale, they had to redesign their forms. But in short, develop forms, but make sure you also test them in context. If your study sites are located in diverse countries, you'll need to assure that those forms or electronic data collection systems make sense to local staff based on workflow and context. This video was a brief overview of the challenges of conducting data management for clinical research in resource-limited settings. We reviewed the importance of understanding the differences in the settings for your study, rethinking your data collection modalities, paper isn't always bad, and redesigning your data collection forms as necessary.